Great, thanks. And welcome everyone to the true ROI of SSO and VDI. I'm Kim Johnson, Product Marketing Manager here for Imprivata OneSign. And so we'll get started by looking at a winning combination, and that's really how I would describe single sign-on and virtual desktop infrastructure, or VDI. We've really seen a strong adoption of this combination in healthcare, and why not? Why not when it delivers thousands of hours and millions of dollars in true ROI? By streamlining access and clinical workflows, you really are saving clinicians time so they can spend more time focused on patient care. VDI allows clinicians to roam throughout the hospital and have faster access at the point of care. But let's start from the beginning. Why is this combination needed in the first place? Well, first, SSO is essential to solving the struggles that clinicians have with how healthcare organizations are securing PHI today. So what we see is that healthcare organizations really go through extraordinary means to put IT security systems in place. They're designed to keep PHI in, but not let it out. And to keep PHI secure, a system of usernames and complex passwords is built. On average, hospitals have 30 to 40 different IT systems and applications that clinicians access on a regular basis to care for patients. That means in a course of a typical day, a clinician may access clinical systems up to 70 times. This creates barriers to patient care, resulting in inefficient workflows and clinicians implementing workarounds, such as writing down passwords, sharing passwords, and leaving access workstations unattended. So a little more convenient, but a lot less secure. With an increase in PHI exposure, just one of these workarounds can result in a cybersecurity attack or HIPAA violation, which results in irreparable reputational damage and cost. However, overall, those barriers, the usernames and passwords, really are not working. Healthcare is embroiled in a massive cybersecurity war, with 90% of healthcare organizations reporting they've been compromised by a cyber attack in just the past 2 years. So with usernames and passwords getting in the way, clinicians are struggling to spend more time with their patients and less time with technology. This frustration also blocks them from being able to adopt technology, such as the EHR. Now, as mentioned, VDI and SSO are complete complements of one another. Without VDI and just SSO enabled, the clinician is having to repeat the opening of applications and start over at every workstation they access. Without SSO, the login process for the virtual desktop is slow, taking up to 3 to 4 minutes when the clinician accesses it for the first time. So without VDI and SSO, clinicians have to physically log in, start each application, log into multiple applications, and then the whole reverse of that to log off of a workstation, all of which could take minutes. Now multiply that across an entire shift, and that could be up to an hour of time logging in and out of applications throughout the day, time which could have been spent with patients. So as mentioned, SSO and VDI is a winning combination, which really delivers true ROI. But first, let's talk more about the adoption of VDI. Why are healthcare organizations adopting it, and at such a high rate? By the end of 2017, adoption is forecasted to be over 81%. I realized there was a critical problem happening in our clinical space, says John McFarland, the Director of IT Business Management at Moffitt Cancer Center. We asked him about his reasoning for adopting VDI. We were starting to roll out physician documentation, getting ready for CPOE. And we realized that the existing process for physicians to access applications as well as information was too long. We weren't going to be successful at either deployment if things continued as such. For McFarland, VDI and SSO were the answer to his clinician productivity problem. Other healthcare organizations felt the same, and indicated that one of the driving forces for VDI implementation was enabling care providers to spend more time with their patients and less time with technology. Josh Wilda, Vice President of Information Technology at Metro Health, implemented VDI in order to deliver an experience to clinicians that allowed them to treat patients anytime, anywhere the patients needed to be treated, anywhere their desktop was. Now with VDI and SSO, clinical workflows are streamlined, improving clinician productivity. By delivering a desktop at the point of care, clinicians can roam access across thin or zero clients without requiring usernames or passwords. Clinicians can get to the critical information and applications they need from any location with just the tap of a badge or swipe of a fingerprint. This optimizes their workflows and saves them time. On shared workstations, clinicians can quickly access their desktop, access patient data, and then tap out to secure the workstation. They could see that VDI helps them with roamability, saving time, having a consistent environment that works, and not needing to focus on technology. Instead, they could be more focused on patient care, said Paul Liu, systems engineer at Pomona Valley Medical Center. Now, just as a quick mention, in Imprivata, we do have tight integration with all those leading virtualization vendors, including VMware Horizon View, Citrix Zen Desktop, XenApp, and Microsoft RDS. We also work closely with the development and marketing teams at both Citrix and VMware. And also we have the tightest and most broad industry support for thin and zero clients, including having the Imprivata one-sign agent embedded at the chip level on thin and zero clients. This is resulting in a streamlined login process for clinicians. Now, with both SSO and VDI, the time it takes a care provider to log in is drastically reduced. One healthcare organization reported that their legacy process on initial boot took 3 to 4 minutes. Well, the same process now only takes 20 to 25 seconds. Another healthcare organization reported that their process that included only SSO used to take 45 seconds. Now with both SSO and VDI, the process only takes 2 to 3 seconds. John McFarland of Moffitt Cancer Center explains why this difference is so profound. Most technicians will say, what, 45 seconds? That's fast. When you put that in the real world, when you think about subsequent logins, and when you think about the impact on the patient, waiting 30 seconds for the desktop to reconnect could feel like a lifetime. The ability to get back to your desktop in seconds rather than minutes really improves patient care. And McFarland says the combination of SSO and VDI together really enabled that further. Also, 2 healthcare organizations we talked to that were launching new hospitals really mentioned that this was something that they wanted to implement as the golden standard of technology. So for them, VDI and single sign-on together was really about implementing state-of-the-art technology. Now, for IT, VDI creates an environment of easier maintenance and management of systems. VDI allows IT departments to retire and replace aging physical PCs, which lowers the cost and times of desktop deployment and decreases overhead costs. And from an administration perspective, implementing VDI means that the IT team isn't tasked with sending out dozens of people to various parts of the hospital to repair or fix an issue. Plus, VDI enables the IT team to easily upgrade multiple desktops and environments all at once. Enterprise security is also a huge concern among VDI decision makers. With VDI, IT departments can easily maintain patch levels for security, as well as remove generic logins, which heightens security across the healthcare system. Now let's take a look at some of the real-world examples of the return on investment experienced by healthcare organizations who have adopted VDI and SSO. Starting with Metro Health. So Metro Health's model is expert care made easy, which the IT staff adopted for its approach to information technology. Now, in an effort to provide higher quality and consistency of care across the network, Metro Health implemented Epic to provide EHR access from the hospital, neighborhood outpatient centers, and participating physicians. While Metro Health successfully rolled out Epic, they began to identify workflows which could be streamlined to optimize the full investment of their EHR solution. They found that their users, both ambulatory and inpatient, moved from workstation to workstation, but accessing different applications and data they needed during a shift proved to be burdensome. They found that users reconnected to their desktop as often as 60 times per day, with each login taking 60 seconds. That's an hour. An hour of their day was spent just waiting for access. Metro Health selected VMware View to streamline and standardize its technology environment, particularly for mobile and roaming care providers. However, they realized that wasn't going to be enough. Although there was now the flexibility to deliver clinical applications and patient information at the point of care, users were still required to provide login credentials at each station. Metro chose Imprivata to do the tight integration with VMware and no-click access for clinicians, and the ability to streamline DEA-compliant workflows, such as EPCS. The combination of virtualized desktops and Imprivata saves each user about 50 seconds every time they access their desktops. Josh Wilda, VP of Information Technology, put it best. Our objective as an IT staff is to give clinicians freedom to perform their daily tasks instead of being forced to deal with cumbersome technology. With virtualized desktops integrated with Imprivata, we are able to meet this objective while maintaining compliance with security and regulatory requirements. In a year, we saved $10 to $15 million by having clinicians spend more time at the patient bedside than logging into the system and doing the work that a normal PC delivery would do. Now moving on to South Shore. South Shore Hospital clinicians needed a quick and easy way to sign in to their desktops and applications, as well as just have more efficient workflows. The nature of their work resulted in users roaming from one workstation to another. And also because of how much time it took to log in, clinicians would often tie up workstations until their tasks were complete, making the workstation unusable for others. Now for security purposes, session timeouts were also set to 9 minutes, after which the clinician session would time out and be shut down, losing all their work. Overall, an increase in workflow efficiency was needed. South Shore proceeded to take 6 months to implement Imprivata OneSign and VMware View Virtual Desktop. Moving to a single sign-on and roaming desktop environment has enabled South Shore Hospital to support its healthcare providers by streamlining their clinical workflows. They experienced such key benefits as reduced roaming and sign-on time, increased user productivity, and improved security. However, most impressive was the ROI South Shore experienced. After looking at the cost-to-benefit analysis and how much time was saved that clinicians used to spend authenticating, it found that each clinician saved up to 15 minutes per day. Over the whole organization, that meant that there was a total of 583 hours per day saved. This equals $5.69 million saved annually and a total ROI of 695%. Now they can get to their complete desktop with applications open in less than 30 seconds during the first login of the day, roam their workstations to a different device in under 10 seconds, and reconnect to the same workstation in 3 seconds. The clinicians are much happier with this solution, says Tan Tran, Director of Technology, South Shore Hospital. Now the last example we're going to take a deeper look into. Published in February in the International Journal of Medical Informatics, the clinical impact and value of workstation single sign-on was written by clinicians for clinicians. Clinical representatives from Christus Health, including Associate CMIO Dr. George Geller, performed an in-depth ROI study of just how much of an impact SSO and VDI had on their environment. The full article is publicly available. You can also find it at imprivata.com under resources. But let's dive into the details. First, a little bit about Christus Health. Christus Health is a mid-sized independent delivery network in 6 U.S. states and 3 foreign markets with more than 350 services, 47 hospitals, and over 15,000 physicians. Christus Health Information Management and Health Informatics began implementation of SSO across the enterprise in 2015. The initial implementation of SSO at Christus Health focused on enabling SSO among physicians, mid-levels, and nurses. Subsequently, access was expanded to include ancillary services, such as respiratory therapists, dietitians, physical therapists, and other care providers who roam the hospital. They're running a Citrix environment for VDI and Meditech as EHR. So why did Christus Health deploy SSO and VDI in the first place? Well, for many of the same reasons that other organizations do. Overall, clinicians have a dissatisfaction with the introduction of the EHR. Actually, for many physicians, EHRs and computerized provider order entry, or CPOE, are among the largest, most dislocating changes in clinical practice and workflow in a generation, according to Christus. Clinicians at Christus were experiencing the same usability issues and interruptions to clinical workflows and patient relations. They were also having time added to an already heavy work volume, as they struggled to access the applications they required. Security and compliance was also a main concern. At Christus, each clinician had anywhere from 80 to 20 passwords to remember and periodically refresh to gain access to their applications. With about 45 applications being accessed, clinicians' time was again being spent on logging in and not on delivering patient care. So to streamline workflows, Christus Health implemented Imprivata OneSign for single sign-on and Citrix for virtual desktops. They were looking to facilitate the adoption and use of their EHR. Roaming access was also a strong value add, so clinicians could have access at the point of care as they move throughout the hospital. SSO was also regarded as a relatively rapid and easy way to facilitate that adoption by using the tap-in and tap-out method with a proximity badge for no-click access. The solutions also help streamline other aspects of the clinician's workflows. Now, password administration was also enabled, and the password change process was removed as a responsibility from the clinician. Applications are also now auto-launched when the user signs in, and the logging of workstations and re-authenticating clinicians when they return increased security while maintaining the convenience clinicians required. For the IT staff, easy profiling and deployment of applications for SSO was done through an easy-to-use GUI with no coding required, allowing them to easily profile their 45 applications. Now, let's look at the time study that they did. The objective of the CHRISTUS study was to assess the impact of SSO implementation in reducing clinician time logging in to various clinical software programs, and also in the financial savings achieved by migrating to a thin client that enables the replacement of traditional hard drive computer workstations. This is a quantitative evaluation. They looked at a 7-day observation period in May of 2016 across 6 of their facilities. They looked at both the pre-SSO and post-SSO workflows and login times, and looked at a total of 65,202 logins into Meditech. They have 5,078 users, but of which only 2,256 were actually active. So they completed 2 samplings of 20 logins for each facility, separated by 1 week. They looked at the data provided by Imprivata and Citrix, such as the number of deployed users, number of active users, number of logins, the SSO application frequency, average logins per user, and also average application events per user. For financial ROI, they used the average national hourly wages separated out by role, including clinicians, nurses, and ancillary staff. For VDI, they estimated the recurrent annual expenditure savings created by replacing computer workstation hard drives with thin clients using cloud processing. Now, based on this evaluation, SSO and VDI is delivering substantial clinical value, recurrent annual ROI, and net cost savings to the first 6 facilities implemented within the CHRISTUS hospital system. As you can see, in the first 6 facilities, a total of 1,461 hours per facility per year is saved, equaling over $92,000 in financial savings. Now, once CHRISTUS rolls this solution across all 18 of their planned facilities, they're expecting an annual savings of over 26,000 hours and $1.6 million. Once the additional $700,000 from switching to thin clients is then added in, CHRISTUS will have a total of $2.3 million in expected annual savings. For CHRISTUS, single sign-on in VDI is an effective and cost-effective method to liberate clinician time from repetitive and time-consuming logins to clinical software applications. Now, as CHRISTUS mentioned, their SSO implementation, to be at its best performance, is truly best combined with the migration to thin clients and VDI. Now, CHRISTUS Health, in addition to time and financial savings, also experienced additional benefits. Really, it facilitated the adoption of key applications and component functionalities within their EHR. That increased clinical and end-user satisfaction with the IT teams. And then the other side effect was that other departments started requesting single sign-on where it hadn't been rolled out yet. There's also an increase in retention and reduced costs associated with high clinician turnover. Security and integrity to help support HIPAA compliance was also increased. There was a reduction in IT service desk calls due to password reset functionality that's currently being evaluated. But this is really allowing those resources to be liberated to focus on other needed service support. Also, there was an enhanced adoption of digital documentation and made CPOE just that much easier. Overall, CHRISTUS said it was a strong clinician satisfier in an era of typically dissatisfaction with technology being introduced. So today, healthcare organizations are in agreement. They would recommend the adoption of VDI and SSO. Whether you deploy them together or one before the other, SSO and VDI are complete complements to one another. In fact, in 2015, the attach rate between SSO and VDI was at 88%. VDI has the capability to unlock the full potential of your SSO deployment, especially with the introduction of thin and zero clients. And organizations found that SSO made the adoption of VDI easier for end users, as the value of VDI was easier to see with SSO. A simple badge tap to sign in almost became a critical component of their VDI strategy. Matthew Barrett, Director of Infrastructure and Security at Jefferson Radiology, described SSO as a driving force for the VDI implementation. Jefferson Radiology coupled VDI and SSO together, which helped to win people over because care providers could immediately see the benefit of speed and ease. Now, before I wrap up, I quickly wanted to mention our last 2016 VDI report. So for years, we worked with our virtualization partners, other healthcare organizations around the world, and we really have predicted that healthcare organizations would continue to adopt VDI. However, in 2016, we thought it was really time to hear from other healthcare organizations. And in that spirit, we chose to interview 8 of these healthcare organizations listed here to understand how they implemented VDI, the results of those implementations, and any future trends they are watching or expecting. As Mike Atchison from Pomona Valley Hospital Medical Center said, in healthcare IT, there's a lot of sharing of information. We share how we do things, we share how we build things. So that full report is available at imprivata.com. So with that, that wraps up the initial presentation. I'm going to open it up for Q&A, and we will look at some of the questions we've received. So the first one that's come in is, if I'm interested in taking a look at possible time savings at my organization, do you have a tool to help with that? So yes, the answer is definitely yes. We have an ROI calculator for Imprivata OneSign, but just time savings in general, where it really is interactive. You can enter in how many clinicians you have, what the typical shift is, associate that to a dollar amount. So that's absolutely something that we would be happy to walk you through. Make sure you get your numbers in there and you can see the time savings that you would have on an annual basis. So another question that came in is, typically are organizations rolling out SSO and VDI at the same time, or do they do it separately? So that's a great question. From the report that we had that we interviewed those 8 customers, it really was a mix. Some of them had SSO first, some of them had VDI first, but really best practice, and when I asked even the ones that did it separately, they recommend to roll it out together. So if you have a VDI project that you're currently looking at, highly recommend seeing if SSO makes sense to add to that project, and also vice versa, right? If you have SSO, does it make sense to enable VDI for that roaming access for those users? And then the last question looks like that just came in was, what best practices have you heard from organizations? So I'm assuming this is best practices for VDI and SSO adoption, right? And so in that report, we have a whole list of them broken out, but some of my favorites anyway. One of them is that planning is key. Implementing something like this is really, it's essential to plan and make sure that you have the right rollout strategy, that you understand how it's going to be deployed to different departments. And that kind of ties to the other point that was made, which is it's extremely important to understand clinical workflows. Not all clinical workflows are created equal, and so it's good to know how your ER department is going to use it versus your nursing floor versus other areas of your healthcare organization, because they might just be different. Also, the other big thing that we're focused on at Imprivata is, yes, convenience is a critical component, making sure that that workflow is streamlined, but also anytime access or even no-click access still has to be secure. So making sure that you're doing a good job of balancing security with the convenience that you're providing. And then finally, I think just overall, I've seen healthcare organizations get into this, is don't overdo it. So there are definitely cases where VDI is not an appropriate solution for users. Maybe they're not roaming, or it's a more standard workflow, something that just doesn't make sense to have that virtual desktop. That goes back to planning, right? Understanding what your workflows are that you're trying to support, what you're trying to accomplish, and just make sure that you're not doing a one-size-all-fits approach. So more of these are in the report. Just looking, doesn't look like we're getting any more questions. So with that, I will wrap up. As you can see here on the slide that's being presented, if you would like the report or any of the case study information that's been presented today, please email mlazardo@imprivata.com. That's Miriam, and she'd be happy to get those over to you. Or as I mentioned, most of these can be found on improviso.com under resources. Great, so thank you for your time and attention, and hope you enjoyed the webinar.